This patient was referred to me for endodontic treatment of tooth number 31. According to the patient, his dentist did the filling for him a few weeks ago, and now the tooth hurts to pretty much everything, heat, cold, and biting down on it. And his dentist told him that he needed a root canal on this tooth. Tooth number 30 RCT was done a few years ago, and you can see a periapical lucency associated with that tooth also. So we discussed options with the patient, and the patient wanted to try to save the tooth. So today we worked on tooth number 31. He'll come back so we can redo the root canal on tooth number 30. So I went through the amalgam on the occlusal. These were 24 millimeter long roots. The mesials were 24 millimeters, and the distals were 22 millimeters. And take a look. And as you can see, everything went great. And take a look here. I'm gonna zoom in on this. Look at the S-shaped curvature of the mesial canals. And you might think that the distals were filled short, but no. Radiographic apex, location of the radiographic apex is actually usually different from the anatomical location of the apical foramen. And that's the case here. I confirmed it, of course, using my electronic apex locator and also sterile paper points. And take a look. Look at how many portals of exit we have here. That's 1. That's 2. That's 3. That's 4. That's 5. Everything went great, as you can see. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. And that's another angulation. That's another angulation. And another angulation. But many portals of exit. And again, when working on these teeth, be really careful. Look where the inferior alveolar nerve canal is. Be really, really careful working on these teeth here. The proximity of the roots to the inferior alveolar nerve canal. I've seen cases where the dentist filled the inferior alveolar nerve canal with calcium hydroxide, sealer, gutta percha, what have you. Be really careful in this area.